You're watching Sketchy Medic, brought to you by Elevated EMS Education, the only place where anatomy, caffeine, and chaos collide. Smash that like button, hit subscribe, and let's keep making EMS education way less boring. As an EMT, knowing human anatomy isn't optional, it's essential. Every call you run, every assessment you make, every intervention you perform, it all starts with understanding the body. From bones and blood vessels to organs and systems, this is the foundation of good medicine. Welcome back to Sketchy Medic, brought to you by Elevated EMS Education. Let's dive deeper into human anatomy, Part 2. Arteries are your body's pressurized superhighways, carrying bright red, oxygen-loaded blood from the heart to every vital organ and limb. EMTs must know where to find key arteries like the carotid, brachial, radial, and femoral. Why? Because no pulse, no perfusion, big trouble. Master this, save lives, and flex that anatomy brain. The pulmonary artery is the only artery that carries deoxygenated blood. Mind blown, right? It shoots blood from the right ventricle straight to the lungs to grab fresh oxygen. EMTs remember, trouble here equals poor gas exchange, hypoxia, and respiratory distress. It's not just anatomy, it's the front line of life-saving care. Your pulse isn't just a beat, it's a window into the circulatory system. It's the pressure wave from the heart's left ventricle, sending blood surging through arteries. EMTs feel for rate, rhythm, and strength. Weak, fast, slow, or thready, clues to shock, trauma, or cardiac issues. Don't just count it, read it like a vital sign story. Capillaries are the tiny MVPs of circulation. Just one cell thick, they bridge arteries and veins, delivering oxygen and nutrients while picking up waste. EMTs, this is where perfusion happens. Pale skin, delayed cap refill, that's your sign something's wrong. These microvessels may be small, but they shout when the body's in trouble. Veins are the body's return highways, carrying deoxygenated blood back to the heart. Unlike arteries, they have valves to keep blood flowing one way and rely on muscle movement to push it uphill. For EMTs, understanding veins is key. Think IV access and managing bleeding. Healthy veins mean smooth returns. Damaged veins can cause major problems. The spleen is a vital organ tucked under your ribs on the left side. It filters blood, removes old red cells, and helps fight infections by producing white blood cells. For EMTs, knowing spleen location is crucial. Injury can cause internal bleeding and shock. Protecting this hidden hero means saving lives. Blood is made up of red blood cells that carry oxygen, white blood cells that fight infection, platelets that help clotting, and plasma, the liquid that transports nutrients, hormones, and waste. For EMTs, understanding blood components is key to recognizing bleeding, infection, and shock, helping you provide better patient care in emergencies. Blood pressure is the force of blood pushing against artery walls as your heart pumps. It has two numbers: systolic, heart contracts, and diastolic, heart relaxes. EMTs check blood pressure to assess circulation and detect issues like shock or hypertension. Knowing how to measure and interpret it is crucial for quick, accurate patient assessment in the field. The nervous system controls the cardiovascular system by regulating heart rate, blood vessel diameter, and blood pressure. The autonomic nervous system has two parts: sympathetic, speeds up heart, constricts vessels, and parasympathetic, slows heart, relaxes vessels. This balance helps the body respond to stress, exercise, or injury. Key knowledge for EMTs managing patients' vital signs. The nervous system is the body's communication network, sending signals between the brain, spinal cord, and all organs. It controls movement, sensation, and vital functions like breathing and heart rate. Divided into the central and peripheral nervous systems, it's essential for EMTs to understand how injuries or illness affect this system to provide proper care. The central nervous system, made up of the brain and spinal cord, is the control center for the entire body. It processes information, controls movement, sensation, and vital functions like breathing and heart rate. For EMTs, understanding the CNS helps recognize signs of trauma, stroke, or neurological emergencies to provide timely and effective care. Cerebrospinal fluid is a clear, watery liquid that cushions the brain and spinal cord, protecting them from injury. It also helps remove waste and delivers nutrients to the nervous system. For EMTs, recognizing signs of CSF leaks after head trauma is crucial, as it can indicate serious injury and the need for immediate medical attention. The spinal cord is a vital, tube-like structure running from the brain down the back, transmitting nerve signals between the brain and body. It controls movement and sensation. For EMTs, spinal cord injuries can cause paralysis or loss of feeling below the injury site, so careful immobilization and rapid transport are essential to prevent further damage. The peripheral nervous system, PNS, connects the brain and spinal cord to the rest of the body through nerves. It controls voluntary movements and relays sensory information like touch and pain. For EMTs, understanding the PNS helps assess nerve injuries, numbness, or weakness, guiding treatment and transport decisions to protect patient function and recovery. Sensory nerves carry messages from the body's sensory receptors to the brain, letting you feel pain, temperature, and touch. Motor nerves send signals from the brain to muscles, controlling movement. EMTs must understand these nerves to recognize symptoms like numbness, tingling, or paralysis, which help pinpoint injuries and guide treatment decisions in the field. The integumentary system includes your skin, hair, nails, and glands, your body's first line of defense. It protects against infection, regulates temperature, and helps with sensation. For EMTs, assessing skin color, temperature, and moisture is crucial, as changes can signal shock, dehydration, or other medical emergencies that need immediate attention. Skin is the body's largest organ, covering you from head to toe, about 20 square feet in adults. It's your first line of defense against germs, helps regulate temperature, and lets you feel the world through sensory nerves. EMTs need to assess skin color, temperature, and moisture to spot problems fast, because healthy skin means a healthy patient. The digestive system breaks down the food you eat into nutrients your body can use for energy and repair. It starts at the mouth, moves through the esophagus, stomach, and intestines, absorbing nutrients and expelling waste. EMTs must recognize signs of digestive distress, like pain or bleeding, to provide timely care. The digestive system starts with the mouth, lips, cheeks, gums, teeth, and tongue, where food is chewed and mixed with saliva from the salivary glands. It passes through the oropharynx and down the esophagus to the stomach, where digestion continues. The pancreas and liver produce enzymes and bile via bile ducts to aid digestion in the small intestine. Enzymes are added to food by the salivary glands, stomach, liver, pancreas, and small intestine to break it down. Food is converted into basic sugars, fatty acids, and amino acids. The liver further processes these nutrients, which then enter the bloodstream to be circulated throughout the body, providing essential energy and building blocks for cells. The lymphatic system helps protect the body from infection by filtering fluids through lymph nodes and organs like the spleen. For EMTs, understanding it is crucial because swollen lymph nodes or infections can signal serious illness, guiding patient assessment and care decisions in the field. The endocrine system is a network of glands that produce hormones to regulate essential body functions, like metabolism, growth, reproduction, and how the body handles stress. For EMTs, understanding this system is crucial because hormone imbalances can cause emergencies such as diabetic crises, thyroid storms, or adrenal insufficiency, all requiring prompt recognition and treatment. The urinary system removes waste and balances fluids and electrolytes in the body through the kidneys, ureters, bladder, and urethra. For EMTs, understanding this system helps recognize signs of kidney failure, urinary tract infections, or bladder trauma. These conditions can affect patient vital signs and require prompt assessment and appropriate care. That's a wrap for Human Body Part 2. Hope you learned a ton and it's helping you crush it as a successful EMT. Don't forget to like and subscribe and come back for Part 3. See you soon with more from Sketchy Medic.